Have you caught yourself looking in the mirror for a bit too long? Are you obsessing over a particular part of your body? If so, then this episode might be the most important one you ever listened to. We're going to discuss all things related to self-image, social media, and body dysmorphia or body dysmorphic disorder.
You Are Beautiful, podcast with Jae Kim, ND.
I'm Dr. Jae Kim, and you are listening to the You Are Beautiful podcast with Jae Kim, MD. I'm a facial plastic surgeon in the Washington, D.C. metro area, and I'm on a mission to make the world a more beautiful place, starting with you. You are beautiful, you are unique, and you are worth it. Let's dive right into today's topic. It doesn't matter how you grew up, where you come from, how old you are. Body dysmorphia is a real sensitive issue. It affects, on record, 2 to 3% of the general population, but I'm pretty sure that it affects more of us who haven't responded to these kinds of surveys. Body dysmorphic disorder is an intense fixation on a perceived flaw of your body. This is thinking about it or looking at it for more than an hour in a day. It leads to a sense of shame. It leads to a sense of self-inadequacy and decrease in the idea of self-worth. It's debilitating in that its most extreme form, it can prohibit people from actually ever leaving their house or going out in public. Was this phenomenon around before the rise of social media as we know it? Absolutely. It's just that social media has made this all the more apparent. What are we doing all the time? We're doing this. This is a very useful tool for a lot of things, but in terms of self-image, it can be a very sharp double-edged sword. Now, when we take selfies, we like to pose in different angles to show our better angle or our best angle, right? And so what does that mean? Usually it means like this or like this. And while that's all well and good, like you want to show the best part of yourself to your viewing audience or your followers, there's a dark side to this phenomenon that we call social media. Because everybody is showing their best life on social media, we scroll and it's very hard not to think that, hey, my life should be like that too. Why is it not like that? One of the main reasons that we think our life is not like that is because, oh, do I not look as good as that person? What does that person have that I don't? Maybe they have bigger, brighter eyes. Maybe they have a pointier nose. Maybe they have fuller lips. And will my life be like that if I get those things done for myself? The draw of social media when it comes to our appearances is that it sets standards of beauty that are not our own. And that goes entirely against my philosophy of you are beautiful and you are unique and you are worth it. Even if you don't ever have plastic surgery, those three things remain true. You are beautiful, you are unique, and you are worth it. If you can find a mirror, you should look in the mirror and tell yourself these three things because they are true. For people who have body dysmorphic disorder, that mantra does not resonate with them at all. Instead, they look in the mirror and think, oh, maybe, this little flare of my nose is 1 millimeter bigger than that flare on my nose. For most of us, we know that our noses, are part of the slight asymmetries of our face. We're all a little bit cattywampus, as we say in the South. But suffice it to say that this left side of my face and this right side of my face are not exactly the same. Start with my hairline, for example, right? And it goes all the way from the hairline down to my chin. And for what it's worth, hey, this is how I'm made, and I'm thankful for how I'm made and how I look. That's the confidence that I have in my appearance. Now, how does this apply for you? For those of us who have body dysmorphic disorder, that means that you're looking at yourself all day long. You know, this eyelid is just a little bit different than that eyelid. Or there's this sunspot on my cheek that I really don't like. And no matter what cream I put on it or what laser I get done at the med spa, it's just not going away. And oh my gosh, it's killing me. That's the kind of attitude that people with body dysmorphic disorder can have. One of the crippling things about body dysmorphic disorder is that patients who have this issue tie their self-worth so blindly and so cripplingly to these perceived flaws of their face or of their appearance. They're looking at it for hours at a time in the mirror. They're finding other people online who do not have this perceived flaw, and they're jealous of those people. And their idea of self-worth is so tied to that it's bogging them down and preventing them from enjoying the beautiful features about their appearance and enjoying their life. With the rise of social media as we know it, this sentiment of I'm not perfect and I need to do something about it. You know, there are healthy motivations for that, but when taken to the extreme, this can go on consuming the mind, consuming the emotions, and that's not a healthy way to live. I'm all about helping you become the most beautiful version of yourself. But this is not the most beautiful version in Kim Kardashian standard or the Hadid sisters standard. This is your standard because this is your life. This is your beauty. And the crippling thing about body dysmorphia is that you want your beauty to emulate somebody else's or to be to a standard that is unattainable. Not because it physically is not attainable, but in your mind, it's not attainable. When you're trying to achieve a goal that is unattainable, you're just going to dig yourself into a rabbit hole that you will never get out of. When it comes to people with body dysmorphic disorder and seeking out plastic surgery, a significantly high percentage of these patients will seek out plastic surgery. Some of the more common things that they'll seek out is rhinoplasty. In fact, they'll seek it out multiple times. The thing about rhinoplasty is that with every subsequent surgery, the chance of achieving the desired appearance of your nose goes a little bit lower each time. And the operation for the surgeon becomes harder each and every time. So this is another slippery slope that it's hard to get yourself out of once you're in that rabbit hole. A great example of body dysmorphic disorder comes from the movie Burn After Reading, which was directed by the Coen brothers back in 2008. In this movie, Frances McDormand plays a character named Lily Litsky, and you'll see by her behaviors and by her tendencies, and especially in her interaction with her plastic surgeon, what kind of features people with body dysmorphic disorder have. I think personally it was a great film. It has a very dark ending, which I'm not going to spoil, but yeah, you should watch it when you have a couple hours. So once patients with body dysmorphic disorder seek out plastic surgery, a lot of them will want to proceed quite eagerly in some situations. And for me, that can be a red flag. The idea of somebody changing their appearance, you know, it's not a small issue. This is potentially life changing depending on the type of surgery or the kind of change that patients want. People can be eager to proceed with surgery because they have confidence in me and in my staff and how the whole experience will go. But if there's a reason for concern, then even after consultation, I'll step back and think about that patient and how the interaction was and if they're going to be satisfied with the results. If you have body dysmorphic disorder, you will never be happy with your outcome because there's no such thing as perfection, even in surgery. When you talk about achieving a nicer looking nose, when you talk about achieving brighter, more beautiful eyes with eyelid surgery, These are things that are improvements based on your natural beauty. They're not looking like somebody else kind of standard. That's what a lot of my patients go for, is the most beautiful version of themselves, not of somebody else. So if you don't think that you're beautiful, and if you don't think that there's a more beautiful version of yourself that you can achieve in a healthy manner psychologically, then it's better not to proceed with surgery at all. Because why try for something that's unattainable in your mind? If you struggle with body image, or if you have body dysmorphic disorder, my message to you is simple. Give yourself grace. Know that you are beautifully and wonderfully made. And once you start to embrace that, you will feel much more at ease, and you will recognize that you are beautiful as a unique person. Another key thing to remember is that whatever flaw you see in the mirror, people don't see you that way. They see you for the overall appearance and how you are on the inside. If you have concerns about your self-image regarding your appearance, if you're experiencing or noticing tendencies toward OCD behaviors, or if you feel like no aesthetic professional or plastic surgeon is meeting your needs, please reach out for help. Sometimes it's because you're not receiving the right treatments, but other times it's because your self-image isn't where it needs to be. Talk to a licensed therapist, talk to a psychiatrist, one who specializes in OCD behaviors and or body dysmorphia. It's a beautiful life, and you don't deserve to live trapped in your own head, trapped in your own thoughts about perceived flaws of your appearance. Again, you are beautiful, you are unique, and you are worth it. Thank you for tuning in to today's episode of the You Are Beautiful podcast with Jae Kim, MD. Please leave a review and explore the links down in the description below. If you have feedback about the content of this episode, or if you would like to have certain guests on my podcast, please email podcast@jkimmd with your inquiry. If you would like to visit me and my staff for consultation or treatment, please visit the link at jkimmd.com. Thank you for tuning in, and we'll see you in the next episode.